So this is a story of how an Achilles heel injury catapulted me into a role that I felt utterly unprepared for, being a caregiver for my mother. But before I tell you the story, let me just go back 10 years to provide some context for you, so set the scene a little bit. My parents were recently divorced. My mom was living in New Jersey by herself in a 55-plus community, 3 hours away from where my family and I lived down in Baltimore. So on one of my visits in the beginning of 2021, I noticed my mom had suddenly started walking with a cane. And up until this point, from a healthcare perspective, she had been completely self-reliable, independent. And sure, she had a couple of, health challenges along the way, but utterly, she could basically manage her own care and navigate her own care. So when I saw her walking with a cane on this trip to New Jersey, I asked, "Mom, what's wrong with the foot?" She said, "I have something wrong with the ligament in my foot. I need a small surgery." And from where I sat at this point, it sounded solvable. She'd always been able to maintain on her own. And so I didn't think of it until 6 months later, when I was now home for a holiday visit, and I noticed my mom was still walking around with a cane. And it was my aunt who just casually said, "Well, Gregory, your mother's got an Achilles tendon tear that she's suffering from." And that is where my caregiver journey began. Because it wasn't long after that I realized the ankle was the least of my problems or her problems to deal with. So before I could even process what was unfolding in front of my eyes, I found myself trying to manage multiple conditions, chronic conditions, overseeing a move from New Jersey down to Baltimore, the diagnosis of a chronic cognitive disease, a transition into assisted living, and setting up all new healthcare for my mom, and all of these peaks of care before any quiet valley in sight. Insert AI-generated imagery, and for those of you that know that, how to use AI, you can imagine some of the prompting that went into developing this image. But this is literally what happened to me, and this is what I felt like, and I started asking myself a lot of questions. What if questions? What if I had been more prepared? What if I knew something was going on with my mom beyond just the cane and the foot and the ligament that she told me, which was not the case at all? What information specifically do I wish that I had that would have allowed me to properly and more confidently advocate for my mother when my mother could no longer advocate for herself? And so then I started to imagine, what if we lived in a world where we had the equivalent of Doppler radar for the aging population? Something that would just let us see the cloudy, dark, stormy danger that may lie ahead. Something that could give us any kind of indicator other than our own audio-visual cues from talking to our loved ones that maybe all is not well. And then I started thinking, what if we could transform all this complex medical healthcare information that's really sent to us in multi-channel, print, internet, phones, etc., and transform it into just a simple, easy-to-use format so that patients and their caregivers could be on the same page. And then I thought, wouldn't it be great if we lived in a world where a group of siblings who are looking after one of their parents could all advocate for them by looking off the same set of information and be on the same page about what the situation was with that loved one? And wouldn't it be really great if patients, caregivers, and providers were all on the same page when it came to caring for our loved ones? What would happen? Could we live in a world where maybe there were better health outcomes? Could we potentially lower the cost of care? So these are the questions that I started thinking about. I knew I had to take a crack at trying to figure out a solution on how to make this journey just a little bit easier. So I took advantage of a very unique moment in time. I combined my 2 years of having a front row view of every single healthcare experience my mother had over the last 2 years with our CTO, Justin Shaper's 25 plus years of working with healthcare claims data and healthcare data in general. And together with an incredible team, we built and launched the Illuminator. The Illuminator, very simply, transforms the complex medical and healthcare information out of a Medicare members portal into an easy-to-use and easy-to-understand format so that patients and caregivers can be on the same page. With the Illuminator, patients have access and caregivers have access to the most critical information. What doctors are taking care of my loved one? What medications or specialists, what medications are they on? What conditions do they have? What conditions do I know of? What conditions may I not know of? What medical equipment do they have and why? What's it for? What services are being provided to them from a healthcare perspective and who's providing them and why? With that same information, we made it shareable with a care circle that is around that loved one. So think about a spouse, a partner, a sibling, or a caregiver. And of course, when it comes to acute situations, emergencies, or particularly in my case, a transition of care with a move and all new healthcare, this information is absolutely critical, indispensable, and you'll be asked for it, as you know, 1,000 times, especially in the new care setup. So I'm really excited. We just launched, just talking backstage, we just launched our MVP 2 weeks ago. Our first version of our software is integrated with original Medicare, Part A, Part B, and Part D. So we pull that in. We built the platform to be payer agnostic, because we know that's just one, although a big subset of the population, the MA plans and beyond. We'd love to work with you all as well. But we're really excited about this because our team feels like with the Illuminator, we're going to have an impact on the healthcare system, on patients, caregivers, and the healthcare system all around by 3 particular ways. Better health outcomes. If we had a continuity of care that was driven by informed decision-making, we should have better health outcomes, which ultimately should reduce the cost of care because of early interventions and risk mitigations, being able to see things before they happen and prevent bad things from happening with our loved ones. And then from the caregiver experience, from where I sit, if we could just increase the confidence and lower the stress just a little bit, then I'll take a win in that column every day. So that's what we're up to at Twilight Technologies. We hope to make a difference. We hope you'll join us on this mission. I hope I get a chance to speak with some of you today. And a real special thanks to Jay and the entire Medicarian teams for allowing me to come up here and share my story with you today. Thanks and have a great one.